Hello and welcome to Dental Notebook. In today's topic, we're going to read about the periods of occlusal development. So, the occlusal development can be divided into following developmental period. Okay, first one is your pre-dental period. The second one is your deciduous dentation period. The third one is your mixed dentation period. The fourth one is your permanent dentation period. So coming to the pre-dental period, so this is a period from birth to 6 months of age. During this period, no teeth are present in oral cavity. Sometimes, very rarely, if neonate are born with teeth, then they are called as neonatal teeth. Okay, and it is mostly seen in mandibular incisor region. Okay, so generally no teeth are present in the oral cavity. So how does the oral cavity look like? So oral cavity contains a gum pad. So here, what is a gum pad? Gum pad are nothing but a alveolar process. So these are the alveolar process at the time of birth. Are called gum pad. Okay, so here the alveolar process are covered by a dense layer of fibrous periosteum and are pink and firm. So they resemble a horseshoe shaped structure. So coming to the gum pad, you can see that the gum pad, as we have already talked about, that this is a horseshoe shaped like structure. These resemble your horseshoe shaped like structure. So the diagrammatic representation of the gum pad, here the gum pad is the one which is peach in color, and the one which is purple in color are your palate and your floor of the mouth. So here you can see that this is your palate, this one is your palate, okay, and this one is your floor of the mouth, and this section is your gum pad. This is your gum pad. This is maxillary gum pad. This is your mandibular gum pad. Okay, so this resemble your maxilla and this resemble your mandible. Okay, so there are different types of grooves which are present. So those grooves are the first one is your dental groove. The second one is your gingival groove. And the third one is your transverse groove. Okay. Now coming to the dental groove first. So dental grooves, these grooves plays a significant role in dividing the maxillary and mandibular gum pads into the two sections. Okay, they divides the gum pads into the two sections. The one which faces your lip and your cheek are called as labio-buccal portion, and the one which faces the palate or your floor of the mouth is called as your lingual portion. Okay, so dental grooves, it divide the gum pad into the labiobuccal portion and the lingual portion. Then comes your gingival grooves. So this part, this section here which I am drawing, this section is called as your gingival groove. Okay, here I am showing both in the maxilla and the mandible. So this section is called as your gingival grooves. So what does it do? It separates. This is your dental groove. This one is your gingival groove. Okay, so gingival groove separates the gum pads from the palate in maxilla, and it separates the gum pad from the floor of the mouth in mandible. So gingival grooves, it separates the gum pad from the palate and floor of the mouth. Now coming to the important groove, this is a very important groove. These are called your transverse groove. So these are the transverse groove. Here I'm drawing a transverse groove over here. So this is your transverse groove. There are total of 10 transverse grooves. So this transverse grooves divide the gum pad into 10 section, and each segment contain developing deciduous tooth. Okay, so they divides the gum pad into 10 segments. Here 1 2 3 4 5, 1 2 3 4 5. So total there are 10 segments. Here also 1 2 3 4 5 6 7 8 9 10, and each of these segments, these are your transverse groove. So this one is your transverse groove. So they contain the developing deciduous tooth. Okay, now there is an important section over here which is called as your lateral sulcus. So it begins from your canine. It is the transverse groove which is between the canine and the first deciduous molar. This is what we call as a lateral sulcus. Okay, so they are present both in these cases. Okay, here it is from canine to your first deciduous molar. So this is called as your lateral sulcus. What will we name as? It will be named as your lateral sulcus. So here there is another point which is called as your lateral sulcus. So lateral sulcus, these are the transverse groove. These are the transverse groove between the canine and first deciduous molar. These are the transverse groove between the canine and first deciduous molar. So what are its importance? It is helpful in judging inter-arch relationship, and the lateral sulcus is more distal in mandible as compared to the maxilla. So here, this is your lateral sulcus of the maxilla, this is your lateral sulcus of the mandible, and this is you can say that this will be more distal. The mandible one will be more distal. The lateral sulcus of the mandible will be more distal as compared to the maxilla. Okay, so this is all about the gum pads. So the upper and lower gum pad are almost similar to each other, but the upper gum pad is both wider and longer. So it is both wider So the upper and lower gum pad are almost similar to each other. The only difference is that the maxillary gum pad are slightly longer and wider, whereas your mandibular gum pad are thinner and shorter. So when they come together, you will see that there is a presence of extra space in the maxilla. This overall area, this area is called as overjet. So what happened? It helped us to achieve, so this alignment help us to achieve complete overjet all around when the maxilla and mandible are approximated. So coming to the relationship between the upper and lower gum pad, so when the maxilla and the mandible, this is your maxilla and this is your mandible. So when they are approximated, the contact generally occur in the first molar region. Okay, this is the first molar region, and this is called as your infantile open bite. This is important for suckling. So I hope you understand this lecture. In the next topic, we will read about the deciduous dentition tear. Thank you.